So I think we should start. We're recording, and I'll continue to work with the stream. So
ready to go?
Yes, so go ahead, Ted.
Okay. Good evening, everybody, and welcome to our second town hall, COVID-19 in our community, facts, myths, and overcoming fear. My name is Ted Burton, and I'm Vice President of Communications for Central Health. And it is my pleasure to be your moderator for tonight's conversation. Apologies for the late start. We are having some technical challenges, but we are pleased to have a really distinguished panel here with us tonight. Central Health and Community Care are honored to partner with Austin Public Health, Community Coalition for Health, and a number of local churches to bring you this town hall series. This is the second in our series. As you know, Central Health is the Travis County Healthcare District, and Community Care is part of our Central Health enterprise and one of the largest federally qualified health centers in Texas. Tonight, we hope to have a very candid conversation about barriers that are preventing communities of color from getting the COVID-19 vaccine and what we can do together to address and remove these barriers. Now, before I introduce our panelists, I would like to welcome Austin Mayor Steve Adler. But first, before any of that, Dr. Charles Moody will lead us in an invocation. Dr. Moody.
Thank you, Ted. Father God, we thank you for this afternoon, and we thank you for this evening. God, I ask that you would bless every family, every person who's been affected both directly and indirectly by COVID. Lord, I pray that you would bless every one of our first line workers who are working so diligently to ensure the health of our community. Touch our leaders as they strategize to meet the needs, and bless everyone that's on this panel. These things we ask in Jesus' name, amen.
Amen.
Thank you, Dr. Moody. Now I'd like to welcome our mayor, Mayor Adler, for opening remarks. Mayor, I know you've had a busy day as well. Thank you so much for joining us. And if you'd like to kick it off with some any comments or remarks, we would welcome that.
Well, Dr. Burton, I appreciate that, and I appreciate the opportunity to speak to everybody. Let me first off by saying that I'm just really impressed with the panel and people that you pulled together tonight to talk to the community. Some of my heroes in the community are here. I sure do want to thank you. I want to thank Pastor Curl and Pastor Jones and for being here and for being part of this presentation. It's real serious stuff, and it's important stuff. This virus is just really taken us all back over the last year. It's had huge health impacts, and it's had huge economic impacts. When you look how Austin's doing compared to other cities around the country, we're actually doing really well. The death rate, mortality rate in Austin is less than half of what it is in the state average. One of the lowest among big cities in the country. There are a lot of reasons for that. I want to thank Director Stirrups on the phone, Austin Public Health, and others just doing an incredible job, but a community that is really, really motivated. I was looking at the numbers here this morning. In our city, the number of people that have taken the vaccine, either 1 or 2 doses, the people that are at this point have some protection, almost 2/3 of the people in our city. But that means there's 1/3 of our city out there that is not being protected. It's the vulnerable part of our community, and there's just something really wrong when we're looking at the numbers and we see what used to be. The people most vulnerable in our community were our elders. Those are our parents that are in the nursing homes, our friends. Those were the folks that were getting hit hard, ending up in the hospitals and dying. We look at those numbers right now, and it is 98% down. The number of deaths and hospitalizations of people that are living in nursing homes and long-term care facilities, 98% down. And there is only one reason for that. And that's because we've been really good about getting the vaccinations and the vaccines to those people. And we've gone in because they're easy to find. They don't run away from you very hard. You know, you can go to the place and they're going to be there, and we can get the vaccinations to them.
Yeah.
But what we're seeing instead, then, is the percentages go down among the folks that are older. Well, now we're watching the percentages of people that are middle-aged going up, and younger folks that are now showing up in the hospitals that are presenting the issues that we have in the community, and it's not right. I mean, those are the healthier folks, but this virus will go after people, healthy, not healthy. But the reason we see this happening now at the lower ages is because it's a group and a population that thinks it can't get to them, and they're not taking the vaccine at the same rate that the older folks have. And then I'll tell you, that it also trends on race and ethnicity. The percentage of people that will line up to take the vaccine or will roll up their sleeve. It varies by race and ethnicity. The numbers we looked at this morning that really concern me are the numbers that say that African American in our community is 50% more likely to not want to take the vaccine. And that is a scary, scary number. But I'll tell you what it translates into. The number of the percentage of hospitalizations that are from the African American community, twice as high as the percentage in our population. And I think that there's a relationship between that and not taking the vaccines the same way. And I understand that. I mean, there are trust issues with respect to government. I mean, there are historic issues that play into that. And it is the result of a lot of the institutional racism and systems that were set up in our society that lead to that. And I know that, but somehow or another, we're going to have to overcome that to be able to protect everybody in our community. You're going to hear from a lot of experts today and a lot of people talking about the vaccine to try to separate the facts from the myths and what's real. And I want everybody to pay real close attention. We know, despite everything that you see on the internet, what you read, a lot of times you don't know where that stuff comes from. But in our city, the vaccine's not perfect, but it's just a handful of people who have been vaccinated that end up getting the virus again. I mean, it is a really, really low number. And what's also real important is that even those people that have the vaccine and then get it, a really small number, almost none of them end up in the hospital. They get it and they don't end up in the hospital and they don't die. This is a community that really needs to pull together right now to make sure that everybody in this community gets every bit the protection that other people in this community get. I mean, it is a matter of equity and fairness and justice that this conversation is about tonight. So I just want to thank everybody on the panel. Mostly, I want to thank the people that are watching this, and please listen to the facts, and then protect yourself and protect your family, because that's really what this is about. Thank you.
Thank you so much, Mayor. And what a great way to tee up this conversation regarding how can we help remove every barrier to get every person in our community a COVID-19 vaccine. I'd like to introduce our panelists and let them introduce themselves, and then we will dive into the conversation. But joining us tonight is Pastor Roy Jones with New Hope Missionary Baptist Church, Pastor Marquette Curl with The Rock Kyle, Mia Greer with Community Coalition for Health, Dr. Charles Moody, the Rock ATX and Community Coalition for Health. We have Dr. Clifton Peel with Community Health Centers. We have Adrian Stirrup. She's the Director of Austin Public Health. Yvonne Camarena, the Chief Operating Officer and former Director of Nursing for Community Care Health Centers. And we have Mike Giesland, President and CEO of Central Health. That's a lot of really distinguished people. And we are honored to have your brain power and your enthusiasm and your passion with us tonight on this panel. I want to just let everybody introduce themselves and just tell us why you wanted to be part of this conversation tonight. And Pastor Curl, I'll start with you.
First of all, good evening, and thank you for allowing me to participate on tonight with this distinguished panel. I'm Pastor Marquette Curl. I am the senior pastor of the Rock Church in the Kyle San Marcos area. And I'm grateful to be here tonight. And it's important for me to be here. I have several programs that I have in the greater Hays County area. I have an education program that's in Hays CISD. And so I've seen the effects that the virus has had on small children vicariously through their parents. A lot of single parent homes where they can't be at home with the children to do virtual learning, the mental health challenges that's been presented with children and adults because of this crisis and because of this pandemic, and just the overall devastation that our communities are dealing with holistically, especially communities of color. And so I wanted to take the opportunity to be able to speak to some of these things on tonight to try to help people to understand the importance of getting vaccinated and the importance of what we're doing to try to get things back to normal.
Thank you, Pastor Curl. Pastor Jones.
Roy Jones, pastor for New Hope Missionary Baptist Church. Excited to be here. First, excited that y'all called me distinguished with all of you guys. So I want to say I appreciate it so much. So I'm honored tonight. I've had some friends that have passed from this terrible disease. I buried a good pastor friend about 2 months ago. I've also buried about 4 other people who've died from this. So the ill effects of this is horrible. But not only that, the mental stress from it is horrible as well. And so our goal here, my goal tonight is just to inform and give people good information and not misinformation so that they will take the vaccination and protect themselves. So it has affected our community and some of my members. And so anything that does that, I want to be a part of that. So thank you for having me here on tonight.
Thank you, Pastor. Ms. Greer, would you like to introduce yourself and explain why you're on the panel tonight?
Sure. I'm Mia Greer. I've been a nurse for over 30 years. I am Chief Operating Officer for Community Coalition for Health, and I'm also the Chief of Staff of the Rock ATX. And in my clinical days in nursing, I always could see the inequities when it came to Black and brown skinned people, when it came to healthcare in general. And then when this pandemic came out, the equities rose to the top when it came to, first of all, getting in line for the vaccine. And then second of all, the myths that we're taking for not getting the vaccine. So we're fighting 2 battles. And so my hope is that doing these town halls that we can get those 2 battles won, so that they know that they need the vaccine, and the inequity regarding the vaccine, it stops.
Thank you so much. And Dr. Moody?
Thank you, Ted, and thank you, Mayor Adler and Mike and Director Stirrup. Thank you guys so much for being here. And I'm here because I'm an African-American pastor. I'm an African-American man. I've buried people, fathers who have grieving families. I've watched my own mother and several of my relatives struggle with not just the infection, but the aftermath of the infections. And I've seen the impact that it's made, not just on children, parents, but just the community holistically. We're a grieving country. We're a grieving community, especially in communities of color. And I think it's very important that we get correct information out. I think it's very important that we really encourage people to take actions that would help prevent death and help to remediate any types of underlying circumstances. So that's why I'm here.
Thank you so much, Dr. Moody. Before I turn it over to Director Stirrup and Ms. Camarena, I did want to remind people that we are broadcasting this live on Facebook. Apologize for the technical difficulties at the beginning, but we're glad to be live now in a different time and place. Maybe a year ago, we'd be in one place all together, having a very different conversation, but this is our new normal for now. If you have questions, if you are watching via Facebook Live, we would encourage you to drop them in the chat, and we will try to respond to these questions during this town hall and get to as many as possible. If we don't get to all the questions, we will capture them and get them answered and sent out to everybody who is joining us tonight and those who couldn't. This is being recorded, this town hall, and will be available for others who couldn't join us live during this event. Director Stirrup, thank you so much for being here today. I know that you've had a very busy day, month, year, like many of the panelists on this town hall tonight. But we'd like to ask you if you could please start out by just giving us the lay of the land for Austin Public Health when it comes to vaccinations in our community and where we're headed.
Thank you, Ted. An honor and a privilege to be here tonight with this group of panelists and to speak on this very important issue. To date, we have vaccinated over 300,000 people. And those numbers are good. But like the mayor spoke to, we are seeing an alarming disparity in the numbers of African Americans that are getting the vaccine. And so working with our partners, we're really trying to figure out what are the points of access? How can we collaborate as a community to make sure while we're working with these big mass vaccination clinics, which are great and serve the general population, we also know that we need a focused outreach strategy for our communities of color. And the Latinx community, that is making sure that we're paying attention to language access and language justice issues, ensuring that there's good information and good translations, and making sure that we're using a place-based focus, right? We want to make sure that we are working within communities to set up vaccination pods that are in places and spaces that that community is used to going to, feels comfortable to going to, where we have a really big marketing push with our Spanish-speaking stations to make sure that we're getting out information about our vaccine pods and just trying to dispel the myth. In the African-American community, it's a little bit more nuanced. And so again, using that place-based focus to make sure that we are in spaces and places that our community is used to going. I love that we are using a faith-based platform to reach that community. The Black church, so to speak, has been the cornerstone of all social justice change in our community. And to use this platform and space to talk about the importance of vaccination is great. So again, I appreciate the time and the energy and talent that each of you will bring to this conversation tonight. And so it's really all of the good work that I've done with Pastor Jones and Ms. Greer and Dr. Moody when we talk about diabetes and heart disease and all of those things where we see disparate outcomes in the Black community. We are going to use an intentional, place-based focused. It's going to be culturally congruent, and that means that we'll have vaccinators and doctors that are reflective of the community. We're going to use images and language that speaks to the community, and we're just going to have that engagement and have these candid conversations to make sure that we are providing enough information so that people can make the best choice for themselves and their family.
Thank you so much. We appreciate that very much. Next, I want to invite Yvonne Camarena with Community Care to give us some more specifics on what Community Care is doing to vaccinate their patient population. And then we'll dive into Dr. Peel, who is also with Community Care, to talk more about the vaccine itself and some of the things that we know people are saying or are afraid of. But Yvonne, did you want to talk a little bit about what Community Care is doing to vaccinate your patients?
Oh, absolutely, Ted. Thank you for the opportunity to be part of the discussion tonight. This panel is amazing, and I think it really will help open some eyes and ears to the importance of the vaccine and offer a real important outlook as far as why this really is our way back to normal. So thank you for that. For community care, we have had incredible opportunities to work both with Austin Public Health and also with our county partners to be able to vaccinate in multiple ways. We have participated in both the mass vaccine clinics and then also started to vaccinate also in our communities. At community care, we are a health center, and so we are part of the community, and we're very well situated to be able to offer our patients opportunities to get the vaccine close to home. So how we started, we have a multiple approach. We also believe that the mass vaccine approach helps a certain population, and then we know we have we need low barrier approaches, and that's what we've done. So for community care patients, what you can do is we have a vaccine center that we established at our old Rosewood, Zaragoza location. And what was great about this approach is that we offer both appointments, or community care patients can just come in. So if whatever time works best for them, we want to be there for them. So we're doing that. We also, anytime you have an appointment, the first question that we're going to ask you is, let's get you vaccinated today. So at our clinic sites, we're offering the vaccine to our patients as well. Now we are transitioning a bit. We want to open more opportunities for our communities. So we're just in the final stages of being able to set up where even if you're not a community care patient, we're going to try to be available there for you and offer the vaccine to at our vaccine sites. So again, our Rosewood Zaragoza site is really close to doing that. We actually are doing our first dry soft opening tomorrow at Manor in the Manor area. So we'll be opening that site, and starting next week, we'll be able to offer it to the community as well. And we're just in the final throes of being able to open up a site in Pflugerville as well. And then we're just constantly looking for opportunities to just continue to expand those services so that we can take full opportunity for every method that works best for our community.
Thank you, Ms. Camarena. We appreciate that. We are going to invite Dr. Peel to join our conversation to talk about vaccines. I'd also like to recognize Barbara Shirley, who has joined the conversation. She's a longtime community care board member and a very well-known member of our community and leader in community ministry. So we're so glad that she's here. Dr. Peel, I know you have a lot to say, but I'm going to start off with a question that we've received from Facebook Live. Somebody said that they had somebody who was going to get the vaccine, but then when they heard it was the Johnson & Johnson vaccine, they were afraid of the side effects. We know that was in the news a couple of weeks ago, and now this person won't take any vaccine. So I'm just curious, you're one of our many medical experts. What is your advice about that regarding the type of vaccine, whether it's Moderna, Pfizer, or Johnson & Johnson? What would you say to this person who is just afraid to get any vaccine now?
Well, first of all, I would just like to encourage the person to know that all three vaccines are pertinent, necessary, and can be very beneficial. Even though Johnson & Johnson was kept off the market for a total of 4 days, so the CDC could have time to look at their data information and possible complications, it was deemed necessary by the CDC board and also by the members who were in charge of the research group. And having to know that 6 out of 6.8 million people developed the DVT or blood clot that was associated with Johnson & Johnson. But just to be relevant as well, Pfizer and Moderna, which are the two-shot vaccinations that we have available, they are 98 and 96% effective, respectively. And as well, Johnson & Johnson has a 72% effective rate. So whichever three of the vaccines the patient feels most confident with, we would like them to proceed forward with at least getting one of the vaccine options.
And is that a question they should be asking when they go to get the vaccine? Should they really be asking which one it is, or should they just get whichever one is available?
Really, if you're a patient that's seeking the vaccine, you should want to know which vaccine you're actually getting and which one has the higher effective rate of treating you and preventing the virus.
And you just touched on it, but as a medical professional, as a doctor, can you assure the people that are watching that vaccines are in fact safe? I mean, there has been conversations about or questions about whether they can give you COVID, or do you still need to get the vaccine if you've already had COVID? How do you answer those types of questions?
Oh, so this is a chance for us to be smart and both diligent. Diligent, what I mean, you as a patient talking to your healthcare and medical professional about what's the best vaccine for you. And if you already have contracted the COVID-19 virus, you are still at risk for getting the COVID-19 again as well. That's why we encourage still to have vaccinations. Even though there have been some hysteria about some vaccines and the vaccination process, I want individuals to know that these vaccines were tested on over 20 million Americans. That's why we can say with some scientific proof and evidence that these vaccines are safe.
Why is it important? This might be a question, Dr. Peel, for you, or perhaps Director Stirrup or Ms. Camarena, but why is it so important that everybody get the vaccine?
Well, first of all, it's very important that we get the vaccine because we want everybody to become immunized against this deadly virus. African Americans who contract this virus have a 50% greater chance of dying from the vaccine, not just being hospitalized or being placed on ventilators, but a 50% greater chance of dying from this deadly virus. That's why I'm encouraging everyone, not just only in the African American community, but every community throughout Austin, Texas, and America, that the vaccine and obtaining at least 1 to 3 vaccines is very important.
Thank you. Good advice. I'd like to bring
Ted,
yes,
Ted,
sir.
just real quick, I just want everybody to know that I took the J&J vaccine, and so did my 30-year-old daughter. I think the right vaccine to take is the one you get offered.
Yeah.
Just want people to know that.
Thank you for sharing. And you look like you're doing fine, so that's a good sign.
And so is she.
Good. That's great. Director Stirrup, I know today that the Austin Public Health released some new updated risk-based guidelines, and the message that really is timely for this weekend, it is Mother's Day. And last Mother's Day, the advice was to stay home, not gather, really continue to isolate. And we have a chance to do things a little bit different this year based on where we are and the update the mayor gave about how well Austin is doing. Would you mind talking a little bit about these updated risk-based guidelines and why this is so important if we do hope to begin to return to normal and to reunite with family and friends and congregations?
Well, Ted, thank you. That's a very good question. And I can pull up the exact
I think we
guidelines
could
if we want
pull
to
up
talk about
the
it in
chart
detail.
as well if we're, but anyway, maybe just an overall, you could talk about what's changed.
So I'm sorry, you'll have to give me a moment to pull those up.
No problem. Oh, no problem.
Memory.
Yeah. And I think one of the main messages that, and it was a release that even Austin Public Health issued today, just regarding if you're vaccinated. It's happening as we speak. There we go. The magic of Facebook Live. So here's the new risk-based chart.
Right. So I guess the way to explain the chart is, right, that we're on the right path. If you know that you've been vaccinated, it is safe to be with your circle of friends that have also been vaccinated. If you want to be with family members that possibly have not been fully vaccinated, then you follow the guidelines. You still continue to socially distance. You try to be outdoors. You take all of those precautions that, make sure that you're enjoying your family, but you're using the optimum level of protection to make sure that you keep yourself and the rest of your family safe. I mean, I had to have this conversation with my mom because she's fully vaccinated and she just wanted to go everywhere and wanted us to come over. And I was like, well, Mom, I got to wait till I get my vaccines, because there's other people and I want to see what's going on with TJ. Like we have to do this as a community. It can't be like I got mine, so it's good enough. We still have to practice measures that keep our families and our community safe as a whole. And I really think that's what the risk-based chart is trying to get at for folks.
Thank you. Thank you for that. I'd like to ask our pastors with us tonight, Pastor Curl, Pastor Jones, Dr. Moody, Ms. Greer. What are you telling your congregations? The mayor mentioned at the top of our broadcast that there's about a 50% hesitancy rate among the African-American community. So there is some skepticism, fear. There's a lot of ways you could probably describe that, but it's also legitimate because there is a history of inequity in our healthcare system. So these fears are real. And I think it's up to us to figure out how do we take down those barriers. So I'm curious from our pastors, what is it you're telling your congregations and how are you encouraging them to get the vaccine? Anyone want to start?
I'll start.
Thank you,
Ted. What we've done here is we've done several things. One is I've done summer series just about inequities, health, and the vaccine and COVID. Secondly, whenever I do sermons, we have moments at the end of every sermon where we have a question and answer. And we brought healthcare professionals and we sat down during the services, and we've had healthcare professionals answer those direct questions from the congregation who may have been there, and for those who stream in. And we had to extend our services because there were so many things that were streaming in, so many questions that were streaming in. We have pushed and promoted the idea of the vaccine. So we deal with the history and the reality of the history, but also we deal with the reality of our own individual responsibility. And so I say, do it for your congregation, do it for your neighbor, do it for your mother. And we've talked about that, and we even addressed the issues of, well, what about the side effects of the vaccine? And we talk about, well, you know what, you don't know what's in a Tylenol, right, but you take it. And so, you take a flu shot, there are going to be some side effects and what have you. So we talk about all those kinds of issues, just practically, straightforward. We sit down, we answer the questions, and then we've signed people up through our own organization, and we've gotten them there and we've gotten them in. So we've done just a wide variety of things.
I'll jump in. Thank you, Dr. Moody, for that, because some of that I may take on, but due to the fact that we had quite a few people that had contracted COVID, there was a real urge for a lot of people to get vaccinated once they did that, because then in real life, in real time, they actually saw what people went through. And so I think that helped, and having conversations with them when we did have service, or when we do have service, a lot of them were running to go ahead and get the vaccination. And at that point, they didn't care if it was Johnson & Johnson or Moderna. Actually, Pastor Moody sent some information to me where I sent it to our congregation to get shots. And so that's the partnership of community and faith, because he sent it to me, I sent it to somebody else, and we did do that. So that was very important. But we had a great response from our congregation to get vaccinated. And quite a few have done that because some have come, and then some have seen those who have contracted COVID. So I think seeing it makes a big difference. There's some people who I think there's some people who haven't really been around somebody who had it, or been close to somebody who had it, or heard about it. But when you actually see people go through it, and they come back 15, 20 pounds lighter, or can't breathe, or take a long period of time to heal, then it's really real in your life. And then there's an old commercial, you was talking about that a minute ago. There was an old commercial, I cannot remember what it was about, but they would say, do it for him, do it for her, do it for the loved ones in your life. I forgot who it was. I think Lou Rawls sung it or whatever. But whatever that commercial is, I think
I'm not that old, Pastor. Don't do me like that. Don't do me like that.
Yeah, I know. But I think that commercial is so important because we have to move past from just thinking about ourselves. It's for our loved ones, for ourselves, for our mothers and grandparents and all those things. So I think it's very important to get the right information. And let me say this also real quick, the fact that with so much disinformation, we have to make sure we get the right information. And I think that's part of the hesitancy. So at that point, we got to keep on getting information out. And I think in turn, that will help with some of the hesitancy when we get out the right information.
Thank you.
Oh, go ahead, Pastor.
So very, very similar to Dr. Moody, I think that the most important thing for me has been information, education, and try to remove any barriers that may exist to prevent people from being able to have access to the vaccine, whether it is, trying to make sure that every single facility that is hosting a mass vaccination, making sure that my congregation is aware of it, trying to answer any questions that people may have about it, any concerns they may have. Of course, taking the approach of, listen, you're doing this for the love of your brother and your sister. Listen, you've worn a mask for over a year because you loved your brother and sister. You've socially distanced for over a year because you love your brother and sister. You've sanitized your hands and temperature checked everywhere you've gone, for a year because you love your brother and sister. And because you love your brother and sister, this is one way to continue to protect your brother and sister is by getting the vaccination. My congregation is a little bit different. I have a millennial driven, for the most part, congregation, which is the, millennials and Gen Zs are the invincible group. They feel like they're invincible. A lot of them have never had to be vaccinated. So it's not that they're anti-vaccination. They just don't understand the need for it because, they've never had to go through it. That's not their generation. Some of our generations had to go through vaccination processes. So, it's not that they don't care. It's just that it's not relative to them or pertinent to them based upon the things they've experienced in their lifetime. And so for me, it's trying to help them to understand the importance of the vaccination and to protect those that are around them, those that they love, their families, helping us to be able to get back together corporately and have human touch at some point, which is very important to everyone. So, I think it's a lot of education. It's being open. It's me as a pastor being transparent about whatever I'm feeling, whatever information I get, being willing to share it, openly talking about it over the pulpit, not running from the questions that people have, but allowing people to kind of talk through their concerns or the issues they've heard or, the misinformation that's out there. So the biggest thing has been education, correct information, and trying to remove any hurdles and obstacles people may have to be able to get access to the vaccine.
Thank you. And you actually addressed one of the questions from one of our viewers who asked why millennials and Gen Zers are so hesitant to get the vaccine and what can be done about that. Ms. Greer, I'm going to put you on the spot because you do work in the community to actually get people to sign up for the vaccine or get them to vaccine sites. And you said you've heard people talk about the mark of the beast and how just the vaccine itself is not of God. And I'm wondering if you would mind sharing maybe some of the conversations that you've had with people in the community about that.
Yeah, so one of the things that we do is we do call. So we'll call and say, have you been vaccinated? Any place, anywhere, wherever it is in the city of Austin, if there's a vaccination going on, I'm sending somebody there through Community Coalition of Health and our Rock Church. But a lot of the things, especially when it comes to Christians, they find things in the Bible that makes them say that this is not biblical. So the mark of the beast is one of the things we're being followed. That's how we're going to start paying our paying our bills is they're going to put that mark in our skin, and that is absolutely false. And I say all the time that even Jesus had a doctor with him, which was Luke. So medicine is something that was done back when Jesus was here, and it's just different. He used dirt to let somebody see. Today we're using vaccines so people can live. So don't use the Bible to kill people. We've done it for years and years. We're not going to use it for this vaccine. The other thing is they don't want us to get it. They want to kill us. And the other thing I say is, well, get behind the line of a white person. If you feel like if they're trying to kill you as a Black person, get in line behind a white person. If they're trying to kill all of us, then they're going to kill that white person that was in front of you, or even ask, can I get in front of you? Because then that vaccine that was supposed to go to me as a Black person, it went to that white person. So it's a lot of misinformation out there. There's a lot of chatter that makes no sense. Using the Bible has been something that has been done since the Bible has been written to advance someone's belief or disbelief in whatever they don't believe in. And so that is so wrong. You go to the doctor, you go to the dentist, you go and get a vaccine.
Thank you. I always appreciate Ms. Greer telling it like it is. So I really do appreciate that. I do want to go ahead.
Real quick. I get so intrigued by the whole tracking you through the vaccine question. And so I always ask people this. Everybody's got one of these. Everybody. And this is connected to a satellite that rotates around the earth at all times. Whenever you talk to Siri, whenever you talk to Alexa, whenever you talk to whatever device you have, you're being tracked. You know, everything gets tracked. All your activity on the internet gets tracked. Your locations get tracked. You check in at the grocery store, you check in wherever you go. So you're being quote unquote tracked all the time. So the government doesn't need to put anything in your body to track you, because you make yourself trackable all the time by the thing that you keep in the palm of your hand 24/7, 365. And you'll leave home. You won't leave home without this, but you'll leave home without your mask. You know, so it's funny when people say, well, hey, they're going to put something in your body to track you, when they don't have to put anything in your body to track you. You make yourself easily trackable because you never leave home with this or without this. So I just thought I'd throw that in.
Yep. Yeah, people might wonder why sometimes they talk about a power washer or a patio furniture, and the next thing you know, they're getting advertisements for a power washer or patio furniture. It's because your phone is always with you, right? So someone's always listening. I have a question. I think this would be for Dr. Peel or Ms. Camarena. We have a question from one of our viewers asking if the vaccine is safe for somebody who has deep vein thrombosis. So we could probably expand that to say, is the vaccine safe for people who have underlying health conditions? I know when you do go to get the vaccine, you have to fill out a brief questionnaire regarding your health situation, but I don't know if Dr. Peel or Yvonne Camarena or anybody would like to address that, Ms. Greer.
Yeah, so even if individuals have underlying health conditions such as diabetes, type 2, type 1, hypertension, had previous symptoms of stroke, also suffer from hypertension, that these individuals are still safe to receive the vaccine and vaccination.
Thank you.
Also, I would add that when you have some of these underlying conditions, especially blood clotting and type of medications that you may be on, you always want to see your doctor because you may be on blood thinners, you may be on blood thinning medicines that you may need to talk to your doctor before you get the vaccine. So if you do have those, I always suggest that.
And when you go to get the vaccine, Ms. Camarena, you might want to talk about the questions that are asked when somebody goes to get the vaccine. There is a questionnaire they must fill out, correct?
Yes. So what we do to help filter the information that about our personal history is we do have a series of questions. And the whole purpose of those questions is so that if there are any possibility that we need to get any type of clearance for your vaccine, we have that information. And whether you get it at a mass vaccine site or, for instance, community care, or at one of the other pop-up events, there will be health authorities there or access to them so that if questions come up, many of them can be cleared at that time. But I do agree that it's always, if you have a great relationship with your primary care doctor, they can let you know before you go to get your vaccine that if you need any particular clearance. But we do know that more times than not, you will be cleared for the vaccine. So please, even if you have underlying conditions, reach out for the information. And we will see most likely that you will be vaccinated. But that alone should not be a hindrance for you to try to seek out the vaccine. You just need the information so you make a really good decision with your provider.
Thank you. We have a follow-up. This is for you, Elder Greer. Somebody says they agree we shouldn't use scripture to support beliefs that something is wrong, but how do you educate people and eliminate the real fear that exists? And I think you've already touched on this, but it is a sort of a universal theme for this conversation. How do we eliminate the fear and remove the barrier so people can feel confident and safe getting the vaccine?
Well, first I want to acknowledge that there's a real fear and a barrier, especially with the African-American community. They put us through some things, you know, and by they, I mean systems. Systems have used us for as monkeys in a lot of cases. You know, we are the ones we have to remember the Tuskegee events. We have to remember that they tested our babies. We have to remember during slavery, they did a lot of things to us that we would today wouldn't do to dogs. So first of all, I want to acknowledge that. But second, I want to also let that person know that you have to believe in medicine. Medicine is what we use. The scientists are who we believe in, and we also believe in God. I can't stress that enough. I can't be a person who can't say that. We know that God is the person who made these vaccines. I've been in medicine, like I said, over 30 years, and this is one of the quickest things. When I was in medicine, it was AIDS, and it took a very, very, very long time. It took years, decades to get AIDS under control. And for us to have a vaccine this quickly for us to live through this virus, it has to be God-given. And I'm just going to say that because of how many times that I've seen people die of different things. My grandfather had polio, so he could tell me how many people that he knew and I knew who had polio. And so just imagine, it usually takes decades to come up with something to cure or to help us to stop having a pandemic. And for this to come out so quickly during a time that we had so many people dying, I can only say we just got to believe it. Because if you look at history, there were millions and millions of people who passed away during pandemics. And it took decades before you can come up with a solution. And this was so quick and so godly and so timely. And that's some of that is science and some of that is my personal opinion.
So,
Please go ahead.
I just jump in there.
Please do.
Since we're keeping it real, I agree with everything you said, but also in full transparency. You know, I was one of those people, because sometimes we're not going to get rid of people's fears, but we can ask people, what are they willing to give up to protect their family? I was afraid to get the vaccine. I was one of those people like, no, I'm gonna wait to next year. You won't be turning me into, like, all the things that we say, right? But then, you know, I was having a conversation with my son, he's 14, and, you know, he was just talking about how he's worried about COVID and will we ever come around? And then I said to myself, am I more afraid of what might happen with a vaccine or of leaving my son. And so I really had to think about that. Every day I put on my seatbelt, I work out, I take care of myself. I'm in an age category, I'm Black, I'm predisposed to so many things that I want to be here to see my son grow up. I want to see my grandbabies that he'll bring forth. And so I finally had to say, I'm more afraid of leaving him in a position. So I'm gonna do this for him. Now, part of me is still afraid. You read science, but that history is real that you talked about. That history is real. And so I think it's important. I appreciate that we're acknowledging that and we're not, disregarding it. But it really comes down to the personal choice that you will make to protect the things that are most important to you.
So Ted, when you talk about fear, African Americans have to deal with fear as a reality all the time, every day, every moment. But one of the things that I would lean on is we're people of faith. This is why, this is why I lean heavily to, in the African American Faith Network, because we're people who believe. We're people who believe, and I tell people that part of the fear process is you have a choice whether to submit to the fear or to press on into faith and to start and to believe God. We teach people that yes, God can heal supernaturally. We teach that God can heal through prayer, but also God can heal through medicine. And they don't contradict one another. So I tell people, listen, you get sick, have us pray for you, but God is not afraid of the doctor. Jesus told the leper, what does he say? He says, now go show yourself to the Pharisee. So he said, now I've done the supernatural, now you do the natural. And the vaccination is the natural. And we're believing God for the supernatural every day.
Thank you, Dr. Moody.
Can I jump in for a second?
Yes,
Ted?
please do. Please do.
I just want to just piggyback on what Dr. Moody just said. Fear paralyzes us. And I thought about this time last year, the countries were feigning for a vaccine while people were dying. And we kept on saying this time last year, we got to hear them get a vaccine. They have warp speed and all that stuff. And imagine 500,000 people have died because of this pandemic. And just think, all those people that died, if they could have got a vaccine, half of them would have got more than half would have got a vaccine. So now we get the vaccine, and now because of misinformation, we're afraid to take the vaccine, which we've been praying for a whole year. And so fear hinders us and it paralyzes us. And we've got to move past this fear. And I think fear, if I was on a Sunday morning, I would tell you fear would be part of the enemy because we are people of faith. And one thing I want to say also, I was thinking about Pastor Curl there. I'm a vaccine child. I grew up taking vaccines from flu, chicken pox. I thought about some other things, polio, whatever it is. I've taken allergy shots. And so if I need to take a shot to protect myself and the family, that's what I need to do. And so I think the information has to be out, but that fear, because we live in fear, it hinders us. It also hurts our families because, again, this time last year, we were like, man, we give us a vaccine, we go back to normal. Everybody's like, I'm gonna take this vaccine. And now we have it. And now we still have fear. So sometimes we live on a what if instead of just saying, hey, let's get the information, do what we need to do best to save our families.
I feel like we're getting a Tuesday night preview of some sermons that might be coming up on Sunday. That's how I'm feeling on this end, at least. We have a doctor and 2 nurses on our panel, and I do want to go back and just answer some questions or ask these questions that some of the viewers are asking. These are medical questions. I'm going to go through these, and Dr. Peel, Ms. Camarena, Elder Greer, whoever wants to jump in, please do. But question we talked about this before, but Dr. Peel, you did a really good job of explaining, if you wouldn't mind doing it again, what happened to the Johnson & Johnson vaccine?
Well, initially happened with Johnson & Johnson to get it full from being in use was it was noticed that it was linked with having a rare blood clot disorder or DVT that was highly associated with the female population as well. But when going back through the research and literature and the data that was collected through the Johnson & Johnson studies and case trials, it was noted that it affected 6 individuals out of 6.8 million that were tested with using Johnson & Johnson. And that's why it was, that's why the CDC pulled it at the time, but has since reinstated it and declared it safe.
Thank you. Another question. This is from somebody asking if they have lung issues, why should they take the vaccine if they already have lung issues?
Well, actually, taking the vaccine is a good reason when you have lung issues. I actually have lung issues. I sleep on a ventilator at night. And one of the things, and I just thank God that when I got COVID, it did not attack my respiratory system. It attacked my digestive system. But if it had attacked my respiratory system, I don't know if I would have survived it, simply because usually COVID attacks the respiratory system. And so if you have a low respiratory system, you have a very, very low chance of living through COVID. So you are one of the people who should have gotten the shot when they offered it the first day. So you were on the top of the list. You were phase 1 because of how dangerous it is for a person with lung issues to get COVID.
Ted, the other thing that I would add to that is, the whole point about vaccinations is primary prevention. And so that's, if for any of us who have chronic illnesses, anything that we can do to help our systems be able to handle that attack of the virus is always what's important. And I think I know that one of the pastors mentioned about the importance of vaccination and what that's meant to us, as a country. And really, we need to go back to having faith in the science of this, because prevention is really what's key to all of this. Because that's what we're hoping for, is if we prevent the onset of the disease, then if you acquire the disease, we prevent the onset of the complications. And I think that's what's really important. So for those of us who have chronic diseases, we are the right population to be receiving this vaccine.
I'm going to continue with the medical lightning round and ask this question. And we've heard this ourselves when we're doing outreach in the community. Is the vaccine safe for people who are pregnant and or who are breastfeeding? Dr. Peel, do you want to take that one?
I was going to say,
Dr. Peel, we're having an audio problem with you. There's some kind of interference.
Hello?
We can hear you, but it's a little bit distorted. You may want to try calling back on your phone, possibly. But let me see if Ms. Camarena or Elder Greer can answer the question about whether it's safe for pregnant women or women who are breastfeeding.
I'll start, and then maybe Ms. Greer, if you want to add on. The studies are coming in now related to some of indicating that it is important that women that are pregnant have an opportunity to receive the vaccine. There is still the caution that they say, talk to your doctor. It's really important. I think we'll have much more clarity in the next few months related to that for both breastfeeding and for women that are pregnant. But I think it's really important that, again, reach out to your primary care doctor, your OB doctor, your nurse practitioner that's helping you through, or your provider that's helping you through your pregnancy or post-delivery, and so that they can work with you and you make the best decision. But I'm anticipating that we'll have positive results here shortly that will be much more direct related to that.
Thank you. We have a question. This is a really timely question regarding where to get the vaccine. And we started off by saying, Ms. Camarena and Director Sturb, you talked about a shift from the mass hubs, mass vaccination hubs to more of the neighborhood place-based clinic vaccination situations. This person has heard that some of these hubs are shutting down because of low vaccine numbers, and he or she and their son would like to get a vaccine, but they've been having challenges scheduling online. I know APH offers walk-up clinics, as does obviously community care. Director Stirrup and Ms. Camarena, would you like to talk about how somebody can easily access a vaccine even without an appointment?
Okay, sure. So as you said, yes, at all of our sites, you're now able to walk up and get a vaccine. No appointment necessary, no pre-registration necessary. And what the viewer said is true. As the demand for the mass sites wind down, we will be able to shift to that more intentional place-based strategy. We're planning to be in more churches. We're planning to be in more housing complexes. We're planning to be at Little Walnut Creek Library because we see that Runberg is an area that needs attention. And so we'll really be able to look at the zip code data and begin to have more pop-up clinics. Some of you who are used to our health equity outreach strategies, you know we have that van that used to go around and do blood pressure screens. When we get to the point that we're in a more place-based focus, that van will go around and give out vaccinations. I know Travis County is doing a really good job partnering with the fire department in that area to make sure that they're going to different places like Walmarts and making sure that we have no leftover vaccine after any site. So yes, you can walk up. If you still feel like you want to call or you have questions, you can call 311 and they will direct you to our equity line where they'll help answer any questions. Or if you're that person who just wants to be sure that you have an appointment, they can help you schedule as well.
Thank you. Ms. Camarena, do you want to talk about, you mentioned at the top of the broadcast, opening a vaccination site in Manor, a vaccination site in Pflugerville's coming. Of course, there's RZ as well. Do you want to just recap that information for community care patients?
Sure. Be happy to. A couple of things. For any of our community care patients, they can just call 512-978-9015, and we will help them make an appointment if that works better. Again, our goal is to have low barrier opportunities and also what works best for our patients. So if you want to schedule an appointment, we want to make an appointment for you, so it's at your convenience. If you realize that you have a bit of time that you can come to our Rosewood Zaragoza, so you can come Monday through Saturday from 8 to 3, and you can go ahead and get that vaccine as well. I do also want to mention that, you know, community care has been part of the Central Texas COVID-19 Vaccine Collaborative, and we are also having a drive-up event this Friday and Saturday from 9 to 4, and that's going to be at the Travis County Expo Center, and so that's the address for that is 7311 Decker Lane. And we will also have that opportunity, and you can just drive up and have a vaccine as well. So we are excited about our Manor location. Again, beginning next week, we'll be able to have, we'll be open not only to community care patients, but to the general public as well. So we'll be working on that also. And then our Pflugerville is, as soon as we have the site built up, we'll be able to do that as well, again, for our community care patients and for our community. So we're looking forward to having that site set up as well.
Great. I have a couple of more medical questions. I'm not sure if Dr. Peel is rejoined audio-wise. One is, will the vaccine be safe for kids? once kids are able to get it.
Oh, can you hear me better now?
Go ahead and continue. I'm not sure yet.
Oh, yeah. So I just wanted to know, there's an ongoing trial offered by Pfizer and both Moderna being conducted on individuals that are 13 and less to see if the vaccine is safe and effective for children. It's an ongoing study and clinical trial that's occurring currently.
Thank you. This is a question that we've heard a lot out in the community, but if you've had COVID and you've recovered, do you still need the vaccine?
Yes, you still do need the vaccine. Approximately, if you contract the COVID-19 virus, you have about 90 days after you contract it, the antibodies to fight the virus are present in your system that can beat back the virus. But after the 90-day period, those antibodies begin to wane or decrease in strength. That's why you currently need the vaccine to help you produce antibodies against the COVID-19 virus.
Thank you. Couple more questions. One is it safe? This is along the same lines for 16-year-olds to get vaccinated. And then I think this is one that a lot of people have been talking about. What will it mean and how will we achieve herd immunity? And will we do it this season? So first, 16-year-olds, is it safe for them? And then back to the herd immunity bar. What does it mean to achieve that, and will we do it this season?
So Dr. Peel, I'll start. I'll take a stab at the age portion of it, and then offer up the immunity component to you. So if you for locations that are offering the Pfizer vaccine, anyone 16 and older can receive the vaccine. We do need their parents to be with them so that they can consent for the vaccine. So it is important wherever possible to find out, what vaccine is being offered, so that you'll know the age range for availability for anyone 16 years and older. So I would just encourage parents or guardians to make sure they ask what vaccine is being offered and to make sure they're accompanying their children so that they can receive the vaccine.
Thank you. And regarding herd immunity, what does that mean? And will we reach herd immunity this year or this season?
So herd immunity means 70 to 80% of the population will have either contracted the COVID-19 virus or be vaccinated against the COVID-19 virus. The reason why this is so important is we've reached the herd immunity stage. That means we are open for large outdoor crowds and indoor crowd gathering with reducing exposure to anyone developing COVID-19. That's why herd immunity is so important. So the CDC seems to think we will not reach herd immunity until 2022 at the earliest.
Okay. I'm going to do one or two more questions, and then I know we're about near the end, and I want to have a chance for all of our panelists to give one final closing thought or message that they would like to deliver for those who are watching or those in our community. There is a question, and Director Stirrup, you touched on this earlier, but someone's asking if they've been vaccinated. When will it be medically safe to stop wearing the mask? And I know there's a lot of conditions as to when you can or cannot go without a mask. And then will a booster shot be required for the fall? But first, if you've been vaccinated, when is it safe to stop wearing the mask? I know there's some different situations where that varies, correct, Director Stirrup?
And so that is a hot topic of debate amongst ourselves, as well as we're trying to craft guidance for the city as we begin to return to work. And so I will say that we are working on what the best response will be. So I don't want to give any guidance at this time. We're not sure yet if a booster shot will be required, but we are prepared in the events to be able to stand up operations really quickly and continue the fabulous network with our community partners to make sure that we are ready and prepared. The same thing goes for when, making sure that kiddos are vaccinated, those who are eligible, we're ready to use our shots for tots clinics and the current structure to make sure that we can provide those services ongoing. Like that's what we do as Austin Public Health. So those plans are ready in place. And as soon as we get the recommendations and the guidance, we'll be ready to act.
And if you have a question about where to get the vaccine or how to get the vaccine, call 311. That's the easiest way, correct?
That's the easiest way.
Or
We're
go
at Delco
online.
Center. Yeah, we're at Delco, we're at Southeast Library, and at the Little Walnut Creek Library. Those are our 3 walk-up locations. And all that information is available on our website, or if you call 311. Yes.
Thank you so much. I know there are more questions. We are capturing those and we will answer them and we will send them out. But I do want to thank our panelists tonight. Thank you, everybody who watched. For your patience and grace as we tried to get on Facebook Live. We did have a technical challenge, which is just the reality that we live in these days. But I want to thank our panelists and offer each of you a moment to share a final thought or final message as we close up tonight. But thank you, Pastor Curl, Pastor Jones, Elder Greer, Dr. Moody, Dr. Peel, Director Stirrup, Ms. Camarena, and Mike Giesland, President and CEO of Central Health. What a panel. We probably should have divided it up into groups of 2 and we could have done 7 nights of these. You guys have so much information to share and it's been really, really helpful. But Pastor Curl, would you like to start out with a closing thought for tonight?
Sure. First of all, thank you for even us all being able to come together and trying to help to do our own part in our each individual communities to try to get things back to normal as soon as possible. So my closing statement tonight would just be one for people to educate themselves, to really understand, the get over the fears and educate themselves about what may be going on with the vaccination. It's important that we do everything we can, our own individual part, to try to get things back to what we would call normal. Whatever our new normal is going to be. I think that we have to make sure that we, fact check all our information. Don't just go off of one source that somebody posts something somewhere, because there's a lot of misinformation that gets spread very, very easily, and you don't want to get caught up in misinformation that creates fear. But understand that we're getting vaccinated because of the love that we have for those that are around us. And whether it's our mother, our grandmothers, we can't have family reunions, we can't gather together with our families, houses of worship, we're still having to be socially distant, even though we've come back together, but it's not the same type of gathering that it was before. And we cannot do that until people around us get vaccinated. And we really, really, really begin to take this seriously. So I would encourage everyone that's out there to do your due diligence. It's always your decision, but think about those around you and how you could be someone that could affect the life of others, not just have your life affected as well. So I just encourage everyone out there to think about the life of others and take the opportunity to educate yourself, and at least consider getting the vaccination.
Thank you, Pastor. Pastor Jones, any final thoughts?
I'm a ditto everything Pastor Curl said, who said it so eloquently. But I will say this to our city leaders. I think our city did a great job during this pandemic, and you can tell by the leadership and the numbers. And our health group did a wonderful job as well, educating us on taking a mask, social distancing, washing hands. So I think we did. It's still work to do, but I think our city did a good job. Just great, just based on the numbers, the first thing. Then I'm gonna follow what Pastor Curl says, educate yourself, and then I'm gonna come and say, take the shot. Thank you.
Thank you so much. Elder Greer.
First, I want to thank everyone. I really appreciate Community Care, Austin Public Health, and especially Central Health, because they allow us to be very creative on how we get people vaccinated. The big thing that I want to tell you that are watching is I'm coming after you young adults to get vaccinated. I'm coming after you. And
They better watch out.
I'm coming, you're next. And if you know anyone who wants to be vaccinated, I know there are people who they may not know how to use the computer. They may not know how to sign up. They may get frustrated. Tell them about Community Coalition for Health. We will help you even if we have to type it in for you. If we have to, we know all the avenues, and so we can get you vaccinated. But if you know someone, please, 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 we get calls every single day, and there's not anyone that we've had that's been turned away from who we sent them to.
Thank you. Dr. Moody?
Oh, thank you, Ted. One of the things that I'm big on is partnerships, and I can tell you, and I can say with a lot of transparency that I appreciate all of the partnerships that are represented on this panel from Austin Public Health, our mayor, then we have Central Health and CEO Mike Giesling, to Community Care, to even the churches, and we're all partners in this, and that's huge, because that's what it's going to take to help and save our community. So thank you guys for all that you do and for sharing time, talent, and all resources, networking. And then I'll say this, Pastor Curl, you said it's your decision, and I want to echo that, but it's also your community. It's also your family, and it's also your life. Please take the vaccination. Vaccines don't save lives. Vaccinations do.
Thank you, Dr. Moody. I want to see if Dr. Peel is with us still and if the audio is working.
Can you hear me?
It's still a little bit.
Well, I just want to say it was a great opportunity to be part of the panel and also to share the stage with prognosticators of the gospel. And I just want to say that as an African-American male whose family comes from a severe, extensive history of heart disease and diabetes, the vaccine is our dose of hope. And I also would like to leave you with this. It's important to know our history, but not let our history hold us back.
Thank you, Doctor. I want to have final thoughts from Director Stirrup, Ms. Camarena, and Mayor. We know you're still with us, and we know you've had a really long day. We appreciate your time here as well. Final thoughts, everybody? Director Stirrup, do you want to?
Sure, I was going to defer to Mayor Adler, but I can go. Just taking it all in, all of the comments that were made and putting a ditto on everything. I saw Walgreens, they did a really nice ad, right? It's our shot. This is our shot. So often in the Black community, we are hearing about how we're behind, in the 15 leading causes of death. We're up there, right? So, but this is the time, this is the moment. COVID is a game changer. We have a choice. We can exercise some free will and control our outcome. And so I would encourage all of you to get a shot. If you're not convinced, I hear this is a series, so come back next time. If you don't have a primary care provider that you can ask these questions of, there's faith leaders in our communities, there's organizations that Elder Greer is a part of. You can get connected, you can call Austin Public Health, we have a nurse line, and you can ask those questions. Don't be afraid to ask questions to get the information you need to take your shot.
Thank you so much.
It's not that easy, but
Ms. Camarena, any final thoughts?
I appreciate it, Ted. I think, information is power. And I think it is important that our faith-based community take advantage of opportunities like this to reach out to the folks that they trust folks who have been there for them, that have helped them through difficult times, and look at your leaders to be able to answer some of these key questions. They're here for you. We as healthcare providers, we're always available to you as well, but know that you're being offered a unique opportunity to get the information in a way that is comforting and factual and helpful for you to make this important decision. We do believe in the vaccine. We do believe in its opportunity to help us get back to our houses of worship and to be able to be with each other again and to celebrate. And this is a great opportunity that we've had tonight to take advantage of getting a bit more information so that we can make good decisions for ourselves, for our families, for our congregation. And I want to thank everyone for letting me be a part of this conversation. And I look forward to the day that we're all together again and we're gathering because we're safe. And just thank you to everyone.
Thank you so much. Mayor, you kicked it off. Would you like to bring it home for us?
Well, I'll try. I'll just start.
High bar.
Start where I started before. It's an honor to be on a panel with such trusted voices in the community. This has been a rough year, but there is light at the end of the tunnel. Everyone is tired now and just really wants this to be over and in our past. And I think that collectively, the people that you're looking at are suggesting that a good way to help put this in our past is for people to get vaccinated. I'll just close with my choice for me, and in the conversations that I had with Diane and our three girls. I am lucky in this position in the short time that I get to serve as mayor, to be in a position where I could see a lot of the numbers that were coming in from hospitals all over the city, from the nursing homes all over the city, to be talking to the medical professionals in our community. And, I hear stories about the vaccine in other places, and I see what, sometimes you can find on the internet. But all I can say is that in looking at the numbers from here, from this community, and in a position where I get to see, I'm pretty sure, all the numbers, the experience that we're having here in Austin, Texas would tell you that this vaccination is safe, that it is saving lives, that it is keeping families together. That's what the information and data is showing, and it's not close. It is overwhelming. And having shared that information with Diane and my girls, I just want to say that the five of us all got vaccinated at the first opportunity. And I just hope that people in our community will heed that same kind of experience that we're having locally, and make that same decision for your families too.
Thank you very much, Mayor. We appreciate that. We appreciate you being here, and a huge thanks to our faith and healthcare leaders that joined us on this call, and those of you that joined us on Facebook Live. And I think Central Health, and we're here to serve. And part of serving is to hold space like this, hold space to have honest conversations about histories, but also about faith and hope. And so thank you all very much. And thank you, Ted.
Thank you, Mike. As I mentioned, and thank you to our entire panel. We really appreciate your time tonight. As I mentioned, this is a series of town halls. This is number 2. We will have one in Spanish on May 25th. But to find out about all the upcoming events, please check out the Central Health Facebook page, which many of you are watching tonight, or our website, centralhealth.net. So thank you, everybody, for joining us. And remember, stay positive, test negative, and get a vaccine. We hope you have a great evening. Thank you, everybody. Thanks so much.
Okay, we ended. Thank you all. So sorry for the technical difficulties, but we went live. Thank you.
Thanks, Anastasia. It all worked out. We appreciate it. Thank you, everybody.
Thank you,
Enjoy
everybody.
the rest of your evening.
Good job, Ted. Thank
Thank
you.
you, guys.
Thank you all. That was
Excellent.
great.
Thank you.